Okay, I'm here with Dr. Wigoda from drwigoda.com, and we were just looking over the American Society for Aesthetic Plastic Surgery trends for 2011, and the first one was brighter financial times.
Lift faces.
Lift faces.
Well, when the economy went down, I think the rate of plastic surgery went down with it. Obviously, people are using their own income to have cosmetic surgery as opposed to insurance covering any of this. So now that the economy looks like it's getting better, I think plastic surgery and cosmetic surgery will increase once again. I've seen it in my office just in the last month. Actually, it's increased noticeably. So I do think that as long as the economy keeps improving, more people are going to continue to do cosmetic procedures.
Yeah, and the second one, piggybacking on that, is more fillers, Botox, injectables.
Well, those are of the things that plastic surgeons do tend to be more affordable. You're talking about less than $1,000 usually versus surgery, which is many thousands of dollars. And once people start doing Botox and fillers, they tend to continue to do it because they like the results so much. So, everybody that's been doing it will continue to do it in general, and then there's always new people trying it. So I think that's just going to keep going up, for a long time.
A massive weight loss leading to more skin tightening, sort of like the Biggest Loser.
Well, unfortunately, obesity is a big problem in this country, and thankfully there is a surgery that helps people with that. The stomach stapling surgeries, and there's obviously different procedures for that. And as people are losing weight, they do end up having a lot of excess skin everywhere from the face, breasts, abdomen, thighs. And so as plastic surgeons, we can remove a lot of that excess skin. And so again, that's typically an elective procedure that people pay out of pocket. And as the economy gets better, I imagine we'll be seeing more of those types of patients as well.
Another one was changing out the breast implants.
The newer breast implants we think will last a very long time. I don't think people will have to change those out. It's possible that older implants that tended to perhaps rupture a little bit more quickly than the newer ones, women may want to change. There was a period of time where most women were getting saline implants. Now, at least in my practice, more women are getting silicone implants. There are some issues with saline implants. They're a little bit firmer, they tend to ripple. And so women who are unhappy with them may start changing them out to silicone implants again as the economy gets better and they have a little bit more expendable income.
Okay, great. And then what about the new ways to add fat? Sort of like the Zeltic that you had talked about a few months ago.
I'm still really not a believer in these quote-unquote non-invasive ways to melt fat. I think if you want to remove fat, you need to do it through liposuction, which is somewhat invasive. These cooling, freezing things on the skin, I just think I don't believe in them.
Okay. More getting that I guess the Kim Kardashian butt.
Well, butts seem to be a big thing right now. The bigger the better, apparently. And there are some things we can do with liposuction, removing fat around the thighs that makes the butt look a little bit bigger. You can also inject fat into the buttock, which the results of that are plus or minus. But I think women are definitely looking more and more at their behinds and wanting to do something with that.
Absolutely. All right, well, thank you so much, Dr. Wigoda, for sharing those 2011 trends with us.
Thank you.